Hello, I'm urologist Omer Erdamakaya. In this video I will talk about what dihydrotestosterone and Andractim gel are. Dihydrotestosterone is synthesized from testosterone with a much more active anabolic and androgenic effect. It was discovered much later than testosterone. Dihydrotestosterone binds much more strongly to androgen receptors. One of the most important properties of dihydrotestosterone in men is that it promotes the development of male organs such as the scrotum, penis, prostate, and testes. Some patients may have dihydrotestosterone insensitivity or a genetic disorder of the enzyme 5-alpha reductase, the enzyme that converts testosterone to dihydrotestosterone. These patients may have developmental delays in male characteristics or in the so-called male organs. Dihydrotestosterone is also one of the hormones responsible for genetic hair loss. Dihydrotestosterone also affects muscle growth, although less so than testosterone. However, one of the major problems with dihydrotestosterone is that it is rapidly metabolized as it approaches cells in the intercellular space. Since testosterone is metabolized less, it can reach the muscle cell membrane and activate the muscle cell. The only legal form of dihydrotestosterone that I know of is Andractim gel. It is a very old product. It has a license in Turkey, but it is not actively sold and produced. There are numerous studies on Andractim gel. It has been used in men with dihydrotestosterone deficiency or hypogonadism or gynecomastia or small penis at puberty. Dihydrotestosterone is also a very important substance for the brain. This is because total testosterone cannot cross the blood-brain barrier under normal conditions. Dihydrotestosterone cannot either, but free testosterone can. In the brain, testosterone is converted to dihydrotestosterone by the brain's own enzyme, 5-alpha reductase, and to estrogen by the aromatizing enzyme. In the studies done here, dihydrotestosterone has a very important function in stimulating the production of our gonadotropin sex hormones such as FSH and LH, along with estrogen. In other words, we can say that one of the most important hormones that provide for LH and FSH secretion in the brain is dihydrotestosterone produced in the brain. At the same time, dihydrotestosterone deficiency can cause symptoms such as loss of sex drive and erectile dysfunction. Here, too, there is a problem. The 5-alpha reductase enzyme system works differently in each person. Of course, free testosterone turns into dihydrotestosterone in everyone, but more so in some and less so in others. This is an important point. 5-alpha reductase inhibitors are also widely used today. They are mostly used in hair transplant centers or in young people who do not want hair loss. In urology, we use 5-alpha reductase inhibitors in men with prostate enlargement symptoms. One of the main problems with these 5-alpha reductase enzyme inhibitors is that they interfere with this dihydrotestosterone mechanism. In other words, they reduce the amount of dihydrotestosterone and make dihydrotestosterone non-functional. Ultimately, hair health is important, but these conditions can affect sex drive. I have already explained in other videos that there are many patients who have had erectile dysfunction for many years because using dihydrotestosterone blockers, 5-alpha reductase enzyme blockers. They have formed associations and websites abroad. As I said, they say it can be risky. Let's give a brief information. In the studies that were done, it said that it can lead to sexual dysfunction of up to 30%, but if we look at the prospectus information, it says that it can lead to erectile dysfunction complaints of about 3 to 5%. Of course, this is a bit ambiguous. As I said, the legal form of dihydrotestosterone is just Andractim gel. It has been used in many areas. In my opinion, dihydrotestosterone levels should be checked in patients with erectile dysfunction. Because if the total testosterone and free testosterone are normal, but the dihydrotestosterone level is low and the patient suffers from hypogonadism or erectile dysfunction, he may benefit from dihydrotestosterone treatment. We need to evaluate the patient from this point of view as well. That's all in general. Thank you for listening, best regards.